We've got a good agenda. If I can just remind everybody that the meeting is being recorded. If you've got any questions, if you could please put your hand up or pop your questions into the chat bar. And if there's time at the end, if there's anything else that anybody wants to raise, we can look at that as well. So we've had lots of news this week in terms of with our the proposed contract changes. So we are going to be looking at that. It was International Women's Day, so I'm hoping my females have celebrated that and embraced that. NHC, we did a bit of we did a bit of taking photos and sharing stories, and that you'll be able to find that on our Instagram accounts and other social media accounts. It was also Social Prescribing Day yesterday, so we've done a bit of work around that, and I think all of us would agree that our social prescribers are quite invaluable to our patient care. So thanks to all of our social prescribers too. Right, so first item on the agenda. Oh, Dr. Sen.
Last night I was reminded by Dr. Patty, who is a GP in Freemason Road, Custom House, that today is the Senior Citizen Day.
Okay. so happy Senior Citizens
Day. I should be.
Thanks, Dr. Sen. So shall we get started? So the first item on the agenda is NHC updates. So hand over to Paul and to Karen. Thanks.
Thanks, Arpana. I'm going to start with two sort of updates, one around the enhanced access, and I'm just going to focus on the service delivery performed by NHC. The second is around some of the service support opportunities and things that we're looking to roll out in the coming weeks and months in terms of supporting practices. If I can just move through the slides. And then Karen's going to give a brief update. So first off, the enhanced access contract. It was a 6-month contract for the commencing the 1st of October. It ends at the 31st of March. And I'm just going to take you through some of the numbers and stats around the delivery of the contract and where we'll be in fulfilling the contract as of at the end of 31st of March. We're on the 10th of March. But when we look at the numbers of activity, so NHC were commissioned to deliver this for a number of the PCNs, and that number today, 3rd of March, was 23,834 appointments. Now, in that time, we've made available 20,000, and of those booked was 18, and the percentage of the commission fulfilled to the 3rd of March is 84%. Now, we have been progressing through the duration of the contract and putting in place a number of measures to make sure that we fulfill and exceed the contract, because for us it's important we make sure we fulfill the contract, and we've got very robust plans and measures in place. So things that have been taking place, for example, is delivery of Sunday clinics. The original enhanced access contract didn't really permit or didn't encourage the Sunday clinics, but actually our experience found they were well received by patients and well received by clinicians. So we've been, for the past couple of months, using the Sunday clinics, and that's allowed us to exceed the available number of appointments that were meant to be commissioned, allows us to then fulfill the entire contract. And actually, when we get to the 31st of March, when we look at the numbers, we'll be delivering 101.17% of the commission appointments. DNAs, just to highlight, 8.9%, and that's kind of in line with previous services delivered and things. And we'll go through some of the service improvements that we put in place to help address some of those issues around DNAs and appointment types. So if I can have the next slide, this is just a breakdown of the PCNs. I'll leave it up, we won't rush through it if people just want to look through it, but basically we have a breakdown. The first column is the appointments commissioned to the 3rd of March, and then those that were fulfilled. And then we've got the period, the 4th of March to the end of March. And this column, there's 7,655 appointments. We're really in the midst of delivering those, and that's all going fine. And then when you look at the full contract period, actually our delivery exceeds the requirements of the contract. So we're fulfilling that. So I just wanted to put that out there. And we are, with the Sunday clinics, because they are working really well, they are rolling over into April, May and June, to continue making sure that we make plenty of appointments available for PCNs. Next slide, please. So estates improvement. So part of the overall enhanced access offer, we wanted to make sure that the access hubs were a good environment for patients, safe for clinicians, and generally just, we wanted to invest in the service and in the, primary care. So we've installed and upgrades of CCTV a number of our sites. We've put new outside lighting. We've replaced clinical space flooring, removal and replacement of treatment room sinks, clinical room furniture, improved security, replacement of door locks, and also put on-site security guards during the evenings and weekends. And all of these things were identified at the beginning when we were assessing the hubs and the sites, and then made sure that these were put in place to improve, again, like I say, the security and the experience of patients and staff. So that these have been put in place and have been actioned. Next slide, please. If there's any questions, I can't see the chat, but I suppose either Nadeem or Arpana will be looking, but do ask questions. We have been doing a number of quality and service improvements throughout the duration of the contract. Being able to respond, we've varied the time frame. I've talked about the use of Sundays. We've changed the proportion of appointments released in advance with each PCN. So through, dialogue, we've been tweaking and refining, when appointments are made available or how far ahead they can be booked by practices and patients. And that's done on a case-by-case or a PCN-by-PCN basis. We've implemented a call and recall service with the single point of access, and this has resulted in an increase in practice nurse appointment utilization. So, making sure that, one of the aims of enhanced access was to replicate primary care, core hours out of hours. And so that call and recall has allowed us to, sort of improve some more of that chronic disease management type appointments, and make full use of the nurse utilization. And historically, the practice nurse has always been slightly less utilized than the GP. So we've, found this works really well to address that. We've reviewed all clinical and non-clinical staff compliance. So that's around predominantly the HR, and making sure that the all the checks are in place, and things including like mandatory training, the DBS, all those safety issues. We've undertaken those activities. We've also introduced something called Clinical Guardian. Some of you may have seen this deployed in a hospital setting, but it says AI there, but it's a form of technology software that reviews clinical notes and identifies those where there may be issues or incorrect coding, or it looks like for that particular type of consultation, it kind of assesses quality. And what it will do is just highlight where the clinical auditors or the medical directors may want to look at clinical notes in a bit more detail. So it's a way of flagging up and highlighting possible consultations that need reviewing in a structured way. And it just allows the auditing to be done at a much, much larger scale. So, it's about using clinician time much more effectively in that audit process. And so that has been going on, and that's allowed us to ensure that the quality of the note-taking specifically and the quality of the consultations are delivered at a high standard. We've also increased reception staff. So we've had, learning from a number of incidents and events that, that increasing the reception staff is a good safety issue. It also helps to support the function of the clinical staff on site. So what we've seen is over the course of the 6 months, we've actually increased the ratio of reception staff to clinicians on each of the hubs, and that also supports with processing admin tasks. And then finally implemented nurse-led consumables and reordering process. So that's just about, you know, streamlining processes and making sure that those consumables are there on site. So these are activities we've done to help improve the enhanced access service. Patient engagement, I'm going to show you a slide about patient survey data, but so we've done a patient survey, but also done a number of other activities, engagement activities to make sure that we promote the service and engage with patients. So as well as leaflets and posters, we've worked with LBN and also made local authority councillors aware, and also been in regular communication with Health Watch to make sure that the service is understood and we're getting the right messages out to a wider population. So that's the range of engagement activities. The survey results is on the next slide. So 88% of patients found booking via the single point of access easy or very easy. 83% of patients were satisfied or very satisfied with the type of appointment initially offered, and that's face-to-face or remote. Then, you know, we've got 81% of patients rated their advised treatment given to them as good, very good quality, and 83% of patients reported their overall experience of the service as good and excellent. So there's definitely more room to improve. We always want to strive to improve, but still it is a service that's received well by patients. And then this last point I think is really positive. 30% of those patients that were surveyed reported that they would have attended A&E if the A&E service was not available to them. So that does show it's having a positive impact to the system, and you know, overall that is a good result. And then we've got some comments from certain individuals there. So
can I just come in, Paul, and just I guess it's a enormous congratulations and thanks to GPs across the whole borough who've delivered a huge amount in the extended access service. You may have seen and heard there's been a bit of media coverage today around how the acute sector has been cutting into their waiting lists, which is great and always good to hear. But I think it's so positive, and we certainly want to celebrate that primary care has delivered an enormous amount over this winter period of additional access and additional appointments. And I think it's something that we should be celebrating. So congratulations to everyone. I think it's a huge endorsement of general practice and how you've delivered for residents and patients across the borough.
Thanks, Karen. And just one thing that I wanted to mention, you know, the Sunday clinics that you were talking about, those Sunday clinic appointments are not actually part of the contract. They're extra appointments that NHC has been offering. So just, I'm sure if people are not aware that the NHC is providing extra appointments on top of what they're contracted to do. Just one comment about the 30% would have gone to A&E. I think in reality, I think colleagues will agree it's probably higher than that. And I think that a lot of the patients that are being seen, that are sometimes going to A&E are for things that should be seen within the general practice setting in primary care. Sabir?
Yeah, I just wanted to ensure that our colleagues that as a clinical governance, we ensure that our doctors are up to date with the knowledge and skill they needed. They are constantly monitored with a system called Clinical Guardian, and they are given face-to-face feedback. Also, if there is any safeguarding issues, it comes to me, and the things are dealt within 48 hours. So I wanted to ensure that the service has been provided has got adequately monitored for the clinical safety and the patient effectiveness. So, but any of the colleague has got any issues about any of the service provided, please feel free to speak to me, phone me, or give me the feedback, and we'll act on your advice. Thank you.
Thanks, Sabir. So, Paul, there's a question about the Sunday appointments. I think was I wrong in what I said, or was that correct? It starts.
Oh, I was
I'll
just
let you answer that.
Counted into. Karen's just answered it.
Okay.
They are counted into. It was what you were saying. They weren't part of the original contract because actually the Sunday appointments wasn't a requirement for the enhanced access appointments.
And I mean, Laura, I know obviously Docklands have been delivering theirs, and it would be really great to be able to say something so positive, because I know that across the whole borough, GPs have been delivering, you know, fantastic additional service in this. So it would be lovely to reflect the whole borough's delivery on that.
Yeah, of course. I was just trying to clarify, and I think that you've made it clear now, because yeah, like you say, they're still included in the enhanced access, but they're outside of the actual ask of the appointment. Similar to Docklands, we offer face-to-face 7 to 8 in the morning ones, but they're still counted as our enhanced access hours with agreement. So I was just trying to clarify that. But yeah, we've had great success as well. So it's been really, really good all round, I think.
No, and it's a real endorsement of general practice, getting those appointments out there. We get so much criticism, don't we, of access, and yet here is additional offers right the way across the borough. It's a real positive story, I think.
Yeah, but we'll talk about access when we come to the contract changes, I'm guessing. The next few slides, I just want to highlight some of the activities. So like NHC, you know, with the business plans and the aims and visions and things, is to support general practice in Newham and you know, to have thriving practices and, you know, support them with things like CQC and some of the everyday activities wherever we can sort of best help. And through the past year, we've done a number of different activities and based on the feedback from practices, what have been helpful, not helpful, etc. You know, we've got these 3 offers, and we're only able to sort of do these through the success of delivering the services like enhanced access and some of the other services. And you know, again, this is part of being a CIC as well, about being able to, you know, invest into primary care. So I'll be writing out to practices in the coming week, but you know, these 3 offers are available to all practices within Newham. So the first one is around CQC Compliance and Inspection Preparation Support. So quite a number of practices have already taken up the offer around mock inspections support, but there's also sort of other variations of that CQC and inspection preparation. I'll just go into a little detail in a moment. Premises risk assessment. So every year practices are expected to do building assessments, health and safety, fire risk assessments. So, you know, and you may have come across a company called Bison Assist. So we're going to, you know, we've negotiated a contract and a reduced fee for all 4 of the inspections, and you know, NHC will be able to pay for those for all practices in the coming 12 months. And then finally, the infection prevention and control audits. You may recall a company called IPC came and did audits right across the borough and all of the practices. They again will be commissioned to do that same service. All 3 are optional. They are not mandatory for you as practices, but they are things that you will need to be able to do or evidence when CQC come knocking. So part of this theory is to take some of that, you know, legwork that's needed when CQC, you know, come and inspect and just those activities. Just going through the slides, and like I say, this will be sent out to practices. So some of the options around the CQC support, we've got a baseline assessment with verbal feedback. We can do it in a bit more of a comprehensive inspection with a written report. You know, and you know, some practices may feel confident or have got good systems in place where it may be useful just to have that baseline assessment just to make sure that you're not missing anything. Those that, you know, it's been a very long time, you've looked at it, you may have had a change of practice manager, and actually having that comprehensive inspection would be more appropriate because it's about just raising skills and awareness. Then there's, you know, different sessions you can put on. Maybe, you know, practice manager training, mentoring is actually an area that needs more support, or it could be around the CQC clinical governance support or QI activities as well, because that's something that's, you know, really positive. You'll know that Sabir is always available for a conversation around your sort of CQC requirements. We also work with a number of other sort of consultants that we can bring in, you know, some that are based within Newham and some externally. So we can get, you know, a range of different views and expertise to support you. And the offer there is the first day and a half is funded by NHC. And then, you know, if you feel that there is more support needed, then you can work directly with those individuals or, you know, use your own staff. But we just wanted to make that, you know, offer available. And, you know, if that's of interest, please contact myself or Sabir, and then we'll, you know, put that in place for you. So that's the CQC compliance. Bison Assist, there have been, you know, quite a number of practices that have used Bison Assist. They operate across the country. They do 4 risk assessments that are really useful when it comes to CQC. So that's your health and safety risk assessment, fire, Legionellas, and disability access. They produce a report with an action plan that you can then implement. And they'll come in and they'll do it all in one day. And then, you know, a couple of days later, they'll provide a report. We will pay for that, for Bison Assist to come out and do those assessments for you, those annual assessments. The way that it will work is that you contact them directly. We will provide them a list of the Newham practices, and then if you're on that list, then, you know, they will send the invoice to us as opposed to picking it up at a practice level. So that's the Bison Assist. And then the next one is the Infection Prevention Solutions, IPS company. And again, they will come and do an audit in each practice. And they will, the way they did it last year is they will contact the practices and see if you're interested or wanting an inspection. Again, it's not mandatory in any way, it's at your request. But that offer is there. They are also going to be putting on some training, because there are some changes to the cleaning standards, the NHS cleaning standards for consultation rooms and clinical spaces, which is sort of has come in new in the legislation, and actually not everyone is aware of. But I do know that when CQC, they will want to know whether you have an understanding of those new guidance and guidelines. So if you are able to demonstrate that you're working towards them, then that will reassure the CQC inspectors. So they will also be putting on a training session for, you know, representatives of practices to attend. I will write out to practices and let you know that how to get involved or, you know, participate in all of these services. I think that's, yeah, contact details at the end, but I will write to you. Any questions?
So, Paul, there's one question from Dahlia saying that if the practice has already had their assessment,
if it's
will NHC cover the invoice?
Right. So we've negotiated a cheaper rate. So there's a couple of things here. If at Custom House you've done it in, let's say, in the past month, then we can probably arrange for them to issue a credit note and for us to pay them directly. If it was done a little while later than that, what I would say is you've now got that valid Bison Assist for this current year, and actually in 9 months' time you will need to do it again. So what I would recommend is actually book it in for 9 months' time, and then you get the continuity for the following year. So you won't lose out. It all just depends when you have that assessment booked or undertaken by Bison. But give me a call. It was done in the last 2 weeks. There you go then. I can, if you send me, if they've already issued the invoice, send me the invoice via email, and I will pick that up, because we've had a similar situation with another practice that had it done only a week or 2 ago. So yeah, we can sort that for you.
Thanks, Paul, for that. I think a lot of practices have utilised these services that you're setting up, and I think a lot of them have had quite positive experiences with this their subsequent CQC inspections and things. So thanks for being responsive to the practice's needs. If anybody's got any feedback that they want to share, please do share with us of your experience with all of this. Thanks.
Yeah, and I think it's probably worth saying that if you think there's other things that every practice pretty much would find useful, can't say forever that we would be able to, but always happy to explore these things, because sometimes it can be more cost effective to get a solution for the whole borough and things. So, you know, if you've got ideas that you think would be useful in this package of support, then do let us know.
Thanks. So, Paul, I don't think there's any other questions. There's some thank yous to you, though.
Thanks.
Thanks.
Thank you for that. Yeah.
Over to you, Karen.
Thanks. And I just wanted to update colleagues on some thinking. We're not 100% fixed now on this one about how we use this time, the GP webinar and the practice council meeting that happens every month as well. So just roll on to the next slide, Steph. So there's been a bit of conversation with lots of different people about the number of meetings we all have, not just the sort of GP webinar practice council ones, but the commissioning meetings, the array of things that many of us end up spending a lot of time in. And one of our thoughts is to try and consolidate some of those meetings. And I know commissioners are looking at how they do some of that, and we're certainly putting them under pressure to try and reduce the number of meetings where possible. And we felt that we ought to play a part in that. So Nadeem and Arpana have had conversations with Wax and Rima, who look after the Practice Council, and we'd like to suggest that we bring the two meetings together. So the suggestion is that we sort of have 45 minutes with what you might call GP webinar type content. So we've always tried to make these sessions sort of information sharing, updates from partners and the likes around things that we think practices will want to know and find useful. And I know the Practice Council have tended to be more discussive and more focused on key issues where commissioning challenges or issues of sort of concern that practices have raised. So what we are thinking to trial is to sort of do 45 minutes of that kind of news broadcast information sharing, and then 45 minutes where we have the more discussive Practice Council items. It may not work well, but we're going to try and give it a go. And I know that Wax and Rima are going to raise it at Practice Council in a couple of weeks' time. If anyone's madly against, or you feel it's really unhelpful or whatever, or to be honest, you've got other thoughts on it, then let us know. But we thought that if we circulate the idea and get a bit of feedback this month, potentially we'll trial it April, May, June, and see if we can make it work that way. And hopefully what we'll do then effectively is remove one meeting out of the calendar for you all. So just sort of giving you the heads up that if you think it's not the right approach or you've got concerns or anything, please then, you know, drop us a line and we'll rethink. But hopefully it might bring a little bit of a time for everyone to get back. That was it. Thank you, Arpana. Although I'm happy to take any questions now if people have got comments or thoughts.
Thanks, Karen. Any thoughts from anybody? Tammy.
No, I think it's quite a good idea, especially as we're trying to have our Tuesday evening drop-in session as well. So I think it's about just making sure that we have a forum for discussion. Sometimes it, you know, a shorter meeting will take that away, but if we have an opportunity where people can just drop in and out, I think that's really helpful. So looking forward to trialing it over those next few months, and if it doesn't work, that we've got the flexibility to come back to the drawing board.
Thanks, Tammy.
And by Tuesday, I meant our unified voice meeting, just so that was clear. Thanks.
Okay, thanks. So I think we are all aware about this and the news that of the upcoming changes that are being proposed to the contract. And I think Tammy and Greg are going to kindly discuss those now.
I think it's me.
Oh, okay.
That's going to do it.
Thanks, Greg.
I'm going to keep this brief, not because it's not important, but I think it's what is important to recognise is that we've had the GP contract letter, and hopefully everyone's seen the 6th of March Amanda Doyle letter, but that is the GP contract letter. We haven't had the GP contract. And the reason I make that distinction is it's one of those, you know, the devil is in the detail situations. And there have been a number of changes to contracts in the past, but we've had the letter and thought it says A, and when the contract comes out, the details either says something which is better than we thought or less good than we thought. So there's still a lot of detail to be worked through and a lot of things to be confirmed. And I think it's just really important to mention that, because what we see in the letter is the headlines, and the letter invariably gives a kind of a, you know, we're tweaking, we're reinvesting, we're listening, but more of that as we go through. To kind of as I said, I'm going to keep it brief because it is more to follow. Important to recognise where we're at. Final year of the 5-year contract framework. And what the contract doesn't give us is a kind of any sense of certainty about what happens at the end of 2024. And again, I'm going to mention that specifically in the context of the PCN DES and primary care networks, because what the contract letter does imply is that there will be a conversation, things will change, and fuller and integration and integrated neighbourhood teams are going to be at the centre of whatever those changes look like. Now, the bit in green, the other kind of contextual thing is a lot of the detail is going to come in the delivery plan for the recovery of access to primary care. The contract letter is about access, and more access. And the recovery of access, and I'm not quite sure why they call it that, because I don't think access has ever been in a situation where it needs to be recovered, but leave that to one side. That is due to be out, I think, on the 15th of March. That will have a lot more detail around the access requirements. The bit in green, this is NHSE's view, significant freeing up of capacity through significant changes to IIF and QOF. Yes, there are some changes. There are some amendments to QOF and the Impact Investment Fund. But my comment about the detail, we don't know what's been added in terms of added bureaucracy, added thresholds, added targets. So next slide, please. Not going to go through all this in detail. Biggie for me, the first point, an assessment of need or signposting at the first contact. There are all kinds of implications for that in terms of managing patients, managing expectations. Are we heading for general practice waiting lists and all of the kind of baggage that brings with it? Targets, reporting, shaming. It just feels like this is kind of it confirms the kind of the approach that politicians favour. Focus on access, we know that, have targets, and if people aren't hitting the targets, you know, let's name them. So leave that one there. Again, more detail to follow in the recovery plan. Access to prospective patient records from October 2023. Again, there's some detail to be worked around. Cloud / digital telephony is going to become mandated. Big push for implementing that. There's going to need to be some really careful thinking through about how practices who are currently not embedded as part of that strategy are bought out or supported to buy out existing contracts. So again, that watch this space on that one. Next slide, please. I'm not going to go through these in detail. It's kind of been trumpeted that by tweaking the IAF and QOF, a lot of work has been taken off practices, a lot of money has been freed up, and that money is kind of effectively being used to support general practice. At face value, that might be what that says. Not entirely. My earlier comment around as things are reduced, other things do tend to be added, and watch this space in terms of the contract letter. Yes, there's going to be money paid up front for a monthly capacity and access support payment. That's fine, but what's the requirement around that? With the 30% being used for an achievement payment, again, thresholds, targets, what a practice is going to have to do to be eligible for that. Next point is I think is a positive. Some of the QOF points effectively protected based on 22-23 income. That's okay. But it's not a huge number of points involved in that. And the focus on QI and well-being and workforce, I think, again, is broadly welcome. So next slide, please. Again, some flexibility around additional roles. I mean, I kind of preface any discussion or comment on additional roles with, I still think there are different opinions about how effective additional roles have been in terms of, you know, they were brought in to support general practice capacity in delivering the DES. If I talk to 6 GPs, I'll probably get at least 4 different opinions about how effective they've been. There is still a focus on additional roles. There's still funding. One of the other kind of messages is around additional roles, being given long-term contracts and effectively becoming part of business as usual. I haven't seen the kind of letters written in blood that says funding will be guaranteed and will follow. And again, that the implication is that the money will continue to be there after 2024. But again, it's watch this space in terms of what the detail is around that. Some changes to vaccinating. It's all very well reducing the lower threshold, but if you reduce the upper target, again, that may cause some issues. Again, positive news. In order to be fair, the PCN service specs, no changes. I think it would have been difficult to bring in any changes, given that effectively we're end of 2024 and PCNs are going to be up for review. So next slide, please. This is my final kind of comment. I think that the big kind of disappointment for me is, given the kind of workload, the capacity, the fact that general practice has gone above and beyond during COVID in dealing with the backlogging, dealing with transfers of work. NHC have been completely disingenuous. The contract has been imposed. The General Practitioners Committee rejected the original offer. That was ignored. The contract was imposed anyway. My other kind of concern is around the lack of detail with some of the targets. That's specifically or mainly around the access targets. And again, until we get the contract document out and the access recovery plan, we're not going to know what the requirement is. I've already kind of implied that there are workload implications for general practice. A personal view is that we do seem to be on this slippery slope to the GP waiting lists and GPs having to manage waiting lists and the expectations around that. Again, let's watch this space on that one. But probably the biggest one, and this is what the General Practitioners Committee really fought tooth and nail for, is there is no inflation uplift. There is no recognition of the financial pressures that general practice is under, like every other organisation and every other person in the world. And that has been completely bypassed in terms of the contract discussions and the contract letter. What we'll be looking to do as we get more detail is a kind of a financial analysis of what the impacts and what the implications of the new contract might be for GP practices and PCNs. So as and when we get more detail, there'll be more to follow. But as I said, this is just kind of a heads up with some initial thinking and an initial outline. So hopefully that's helpful. Thank you.
Thanks, Greg. That was actually very helpful. Does anybody have any questions or comments? No? Okay, good. I think everyone's concentrating on sorting out things for this year before we look at next year's work. Thanks, Greg.
Can I just try, and because it's Friday and the snow stopped and the sun's come out, try and end on a positive? I think moving from PCNs or changing PCNs and fuller and integration gives us an opportunity. I've said this 100 times on this and in other meetings. It's an opportunity. We need to shape what happens in Newham and how we develop fuller and develop integration within Newham. We know what the kind of parameters are. I think it's kind of up to us to do something that works for us and works for Newham. On that happy smiley note.
Thanks, Greg. Okay, so the next item on the agenda is Training Hub. So firstly, I just want to start off by saying thank you to Dr. Kavita Gore for all of her hard work over the last few years with everything that she's done with the Training Hub. But I want to now take this opportunity to welcome Dr. Subir Sen into the role. And I think one of the things that I would always say that is Subir is always passionate about most things, and I think it's great to have him share this passion that he has within the Training Hub. So thanks a lot, Subir, and over to you.
Thank you very much. I think it's not really nice to start without really thanking Kavita for all the service she has provided for the last 8 years. And she brings to Training Hub in the positions where it's flourishing now. So to take over her place, and wearing her shoes is difficult. But then I will try what I can match for the general practice. So I would like to really heartiest congratulations to her to move it to now for another job. She moved on and I came in. So I will follow the pathway that she set up, and probably we will make the education and training is the first priority for the Newham for next few years. So what I like to tell about that, the amount of the 3 priorities that I wanted to know. The first priority is workforce development. We know that whether it's a GP workforce, whether it's a multidisciplinary, whether it's ARRS, there is no other way to provide general practice without having more workforce recruitment and retention. The recruitment is a crisis now because there are a lot of PA we advertise, it doesn't get filled up. Even though you give the old sort of mentoring supervisions, but still people doesn't come forward. So I will just encourage people, if you can upskill any of the staff to the level they wanted to go, there is always a provision that you can upskill the staff through the different scheme, that fellowship or any other scheme that you wanted to. Anybody wanted to discuss about any kind of upskilling courses, please contact me and we'll give you the pathway where a receptionist can be HCA and HCA can be PA. Not only that, the good news, from October, we are having apprentice model to general practice. That means a staff who is at the A-level graduate can enter to the general practice, spending 3 days in the university and 2 days in general practice, and still continue 5 years medicine course. The first course probably will begin in October from UEL. So this is our neighboring university. The talk is going whether there will be a department of general practice or promoting that UEL to a medical school. So government has given about 50 to 51,000 funding for the employer to really provide those kind of financial support who wanted to take the time break. So as soon as I get the more information, I will let everybody know. Another things I wanted to tell that one of the workforce we are really losing, the 2 workforce. One is called practice nurse. It's really there is nothing for the practice nurse nowadays. There is not any kind of training, promoting. We need to recruit more practice nurses. We need to place more practice nurses in the general practice so we can have a workforce. The 30% of workforce are going to go retire within next few years time. So there will be a huge vacuum. The other things I wanted to neglect to spice is called practice managers. The practice managers was not been designed any kind of courses in the past. People are doing off-the-shelf courses here and there, but I think with the Newham Training Hub, we wanted to promote those kind of training, which is need for the daily general practice, not only the accounting, also how to really prevent that, what the regulator asking for. We have so many regulators in our lives, so it's more regulation than work. That's why it's always a general practice over-regulated, underperformed. So please, if you wanted to do anything like any training, let us know. We'll really upskill the practice nurses to advanced nurse practitioners. There's a new scheme coming called advanced clinical practitioners. We are going to publish that very soon. We had a meeting last Wednesday, and probably we wanted to promote this kind of advanced nurse practitioner. We can retain people, upskill them, and give them a different kind of flavor they wanted. Finally, I wanted to, is Sadiq Ahmed on the line? I wanted to really welcome Dr. Sadiq Ahmed, who is a new trainer. In my first day on 1st of March, I had a great pleasure to interview Dr. Sadiq Ahmed, who is become a trainer in Newham. He's going to take his first trainee from 1st of October in August intake. Yesterday, we had a trainers workshop. As soon as the trainers workshop finished, we had about 4 applications. These people will be ready for the next September intake. I will really encourage practices. So remember, there is a correlation between training practice and regulatory quality indicator. The people who are the training practice very unlikely to fail CQC. I'm not giving you a token. What I'm telling you, the educations and quality improvements is 2 sides of the belt coin. We can only improve the quality if educate people, give information, give them knowing, showing gap technique. So with further notes, what I wanted to do now, if anybody wanted to become a training practice, please let us know. Please contact me. From the filling of the form to the tutorial to the post-qualification training will be provided. we still have the new trainers who contact me. I really wanted to make sure that most of the training, at least we have 8 training practices by October 2024, because the training are going back to different borough now because we don't have capacity. We are doubling, I probably quadrupled, because remember, supervision and mentoring needs lots of time. So if you need any kind of help on how to supervise, how to do the tutorial, there's plenty of trainers in Newham, they can provide you. So I will just give an honest request to people, contact me, we'll hold the hands, and I will need to show you, because remember, my hand was held by Peter Jones. I went to one of the Sunday afternoon 20 years ago to Peter's house to fill up the form. So there is no harm to ask help even from the form filling. Please come back to me, we'll go together. With that note, I wanted to invite Sadiq Ahmed to just tell his experience, what he went through last Wednesday. Hopefully I didn't give him hard time. Go ahead.
Thank you, Dr. Sen, for letting me speak. So hi everyone, I'm Sadiq. I'm one of the GPs from Claremont Clinic, for those who don't know me. As Dr. Sen said, I did my educational interview last Wednesday. So I qualified out of the Newham VTS maybe about 4 or 5 years ago. I have pretty much trained here, specifically at Claremont, where I was a VTS trainee. My experience of the process, I'll be very honest, was probably a lot better than what I thought it would be. And what I mean by that was a few things. First of all, when you get that form, it looks quite long and complicated. But actually, when I got to sit down with someone and talk through it, and I got help from the likes of Sulu and Kavita, who was doing it at the time, actually, it's a lot easier. A lot of the stuff you're probably already doing, it asks things about policies and things, but many of us have ARS staff who are going for training days and stuff, so we doing this anyway. It's just about knowing what to put in, but they were very helpful, told me what to put in and helped me through it. And even the interview, actually, I really enjoyed the interview. It didn't feel much like an interview. It felt more like a pep talk before you start a new job. We covered what kind of things I was looking forward to, what kind of things I'd be doing. They gave me some really helpful suggestions for my first trainee. And overall, it was actually a really good experience. And I would absolutely echo what Dr. Sen was saying about joining up. We did hear the sad news yesterday in the training hub, in the trainers workshop, that we've had to turn away 6 trainees for the coming year. So this was 6 additional trainees Newham could have got, but because we didn't have capacity, we had to let them go. And we're always forever fighting about staff. We know how hard it is to retain. And so being able to do training and get these GPs in is so important. And there's a lot of support. There's a lot of practices. We've been doing it for years. It's about just knowing and feeling comfortable to ask. And actually, I would encourage everyone, even if you've not considered it, please attend one of the training sessions that is done on a Thursday, where we sort of meet up to see what we're talking about and meet the people. Please discuss with Dr. Sen, or even if you needed help, I'm happy for you to reach out to me with forms, help with like how to do induction plans and things. But I strongly suggest that it was such a pleasant experience. I actually feel a bit silly for not doing it earlier. But absolutely, I echo everything Dr. Sen said.
Thank you. Can I request something? Can we see you so we can put a face to the name, please, Dr. Ahmed?
Yeah,
Thank you. Hi. So thanks for sharing that feedback. And I think that's quite encouraging, because I think the fact that we've had to turn away 6 trainees is quite disheartening, because I think a lot of us, between us, we've got so much experience that we can share. So I think those practices that have any clinicians that are wanting to become trainers, please do come forward and contact Dr. Sen. Sabir, is there anything else that you wanted to add?
Just wanted to say we have a hotspot in Newham where less training practices and more CQC trouble practices. So trust me, I'm not scaring you to become a trainer because you wanted to beat CQC. It's the quality indicator. Because remember, when there's a trainer, I have 3 trainers, and they do audit, they do quality improvement, because this is the part of this is the learning on the game. It's not something theoretical. We are not teaching people to become a professor. We are asking to do a hardcore general practice. What exactly general practice look like? Having training is really, really good for the even they teach me. They just came from the hospital. They knew the guidelines. They are sometimes they're my mentors. So to be honest, having a trainer is really fun. And not only that, these are adult learners, they learn their own initiative. You only need to hold their hand when the things are not going the right way. Otherwise, these are self-directed, they're self-motivated, they went through the whole BTS process, they come to T as an ST3, they're very experienced, you can rely on. Also, there is a bit of service provisions. You are getting trainers money, you get tutorial money. That's a trainer can be off the time, and you can employ a locum at the same time. You can really have some session from the trainees. So there is a service provision, there is an educational provision, everybody together, it's the real fun. Just have a look whether you are really ready. Give me a ring, I will come to your building. You just need a cup of tea and I will go through.
Thanks, Sabir. Just can I just ask one thing? You know, you mentioned that there's various hotspots. So is it worth looking, you know, or worth reaching out to some of those practices? Because I think that, so speaking for myself, I think that there's no trainer within my practice, but I think that I'm so overwhelmed. There's always something else to do. There's always something else going on. So I think that's something that I've not necessarily considered, but perhaps today it might be, after hearing you and Dr. Ahmed speaking, I'm thinking it might be something that I would consider. And I would reach out to you, but maybe it's worth you reaching out to those practices that don't have a trainer already present.
Definitely. We also have few new buildings. I know premises is an issue. The people really don't have enough for the locums and how they're going to accommodate. There is a few new buildings in Newham already approved, and I was going to reach them out. And I really wanted to convince them it's worth doing. This is a very dignified thing to do. I've been trainer for last 18 years. It's nice to see 40 people went through my hand. So it's nice to see there 6 of my trainees are even the trainers, and another 8 are fellows. So it's nice to see that I became a grand trainer.
That's so fantastic.
This is worth living, mate. I know we are stressed. I know that we got a lot of things to do. If I can do it in the IMG, why cannot do it? Just push yourself, reach the boundary, the star in your hand.
Thanks, Sabir. So I think you've convinced me to consider it. So I think those are all the items that we had on the agenda for today. Did anybody have anything that they wanted to raise or discuss today just before we end? No? Okay, great. Thank you all. Have a good weekend. Keep safe with all this bad weather. And it's a few more weeks of hard work, and then we can relax a bit before we will start up our work again. So take care, and we'll see you at the next meeting in April.
Bye, everyone.
Bye, everyone.
Bye, folks.